Welcome to the ICON Study Consensus webinar. This video will quickly remind you about the study and what will be expected of you during the webinar. The purpose of this meeting is to finalise a core outcome set to evaluate interventions designed to improve informed consent for invasive procedures. Before any surgery, adults who are able to decide about their own healthcare must give informed consent. Informed consent is when patients are given information about what will happen before, during and after their surgery, the benefits and risks of surgery, and any other treatment options, including the option of doing nothing. Patients then consider this information and decide to consent or not to consent for themselves. Lots of methods have been developed and tested to improve the consent process. To make sure they work, researchers need to look at the effects these methods have on patients. Researchers do this by measuring outcomes. Examples of outcomes in consent research are how much of the consent information a patient can remember or how satisfied the patient feels about their consent. We do not know the best way of helping patients to give their informed consent, or why one method might be better than another. This is because researchers have measured too many different outcomes in different ways. It also seems that the outcomes used by researchers up to now may not be the things that patients feel are most important. During a Delphi survey, 125 participants from 8 countries rated all the possible outcomes that could be measured in future research, comparing one method for undertaking the consent process compared to another. This process was conducted over 2 rounds, with participants receiving feedback as to how other stakeholders scored each outcome, as well as reminding them how they scored that outcome during round 1. Outcomes were considered for inclusion in this webinar if they met one of the following criteria. Number 1. Greater than 70% of all participants rated it as critical, and less than 15% rated it as unimportant. Or number 2, 3 out of 4 stakeholder groups rated the outcome as critical, even if it did not meet the 70% cutoff overall. At the end of the process, we identified 11 outcomes that met the criteria for inclusion in this consensus webinar. 10 of these met criterion number 1. Of these, 6 outcomes were rated as critical by all stakeholder groups. We propose including these outcomes in the final core outcome set without further discussion. 4 outcomes achieved greater than 70% critical ratings overall, but did not achieve a critical rating in each stakeholder group, and 1 outcome met the inclusion criteria by meeting criterion number 2. We will review the meaning of each of these 5 outcomes in turn. We will display how each group rated this outcome in round 2 of the survey, and discuss whether the outcome should be included in the final core outcome set. We will ask each of you to decide whether each outcome should be voted either in or out. The majority decision will determine whether the outcome is included in the final core outcome set. For those of you here in person, you will be asked to vote yes by raising your hand. For those of you joining us online, you will be able to vote yes or no using the online poll. Remember, this core outcome set will apply to people 18 years and older who are able to consent for themselves to a surgical procedure. Thank you for your participation in this research.